Conversion of external percutaneous transhepatic biliary drainage to endoscopic ultrasound-guided hepaticogastrostomy after failed standard internal stenting for malignant biliary obstruction. Introduction. Endoscopic retrograde cholangiopancreatography, ERCP, is a first-line non-surgical intervention for biliary obstruction, and percutaneous transhepatic biliary drainage, PTBD, is a rescue procedure used after a failed ERCP. As patients with PTBD often feel discomfort from the external drainage through the skin, internal stenting via the PTBD tract, PTBDS, can be performed to allow removal of the PTBD catheter. However, PTBDS is sometimes difficult because the guide wire cannot always negotiate the stricture, or the stricture may not be sufficiently dilated when the papilla is inaccessible and the stricture is long, tortuous, and very tight. The technical success rates of PTBD are reported to be more than 95%, and the rates of adverse events related to PTBD range from 10% to 31%. For PTBDS, the success rates vary, ranging from 46% to 93%, and there is an overall associated adverse event rate of up to 42%. Endoscopic ultrasound, EUS, guided biliary drainage, EUSBD, is an evolving alternative modality to PTBD. However, it carries some risk and is only performed in a limited number of centers. An alternative procedure involves conversion of external PTBD to EUS-guided hepaticogastrostomy, EUS-HGS, which might be easier to perform because the opacification of the biliary ducts is possible through the PTBD catheter. Paik et al. Evaluated the efficacy and safety of conversion of external PTBD to EUS-HGS after failure of PTBDS. Background and study aims. Percutaneous transhepatic biliary drainage, PTBD, is a rescue procedure after a failed endoscopic retrograde cholangiopancreatography. As PTBD causes patient discomfort, conversion of the PTBD to internal biliary stenting, PTBDS, may be required. However, PTBDS is sometimes difficult because of the tight stricture. Paik et al. Evaluated the efficacy and safety of conversion of external PTBD to endoscopic ultrasound-guided hepaticogastrostomy, EUS-HGS, after failed PTBDS. Patients and methods. A total of 16 patients with malignant distal biliary obstruction who underwent conversion of external PTBD to EUS-HGS after failed PTBDS were enrolled from 2 institutions in Korea and Japan. Data were analyzed retrospectively. Results. The technical and clinical success rates were 100% and 81% respectively. Early adverse events developed in 2 patients, proximal stent migration and cholecystitis. Stents were occluded or migrated distally in 5 patients. The mean duration of stent patency was 402 days. Conclusions. Conversion of external PTBD to EUS-HGS may be a good rescue option after failed PTBDS.